we've had a full discussion and you told us what the problems are. Firstly, as far as budgetary allocations are concerned, that's for 67 billion rupees, and that money we are now worked out, come to an agreement how the Finance Ministry and the Chief Financial Officer will spend it. Then comes availability of drugs. So already the Minister is talking with China, and we'll further ask the Foreign Ministry also to get involved. With India, we are virtually coming to an agreement where we can access their stocks, but we'll take that up when you go to India next week. But more than that, we also have the issue of the delay as a result of the procedures that are followed now. That drugs by the FDA, they are also registered by UK, all get held up here. So I've asked the NMRA to go ahead now and immediately approve FDA drugs and the other countries which they have agreed with the Health Ministry. And the Health Ministry will then bring amendments to the NMRA Act, which will enable them to act quickly and overcome all the difficulties. Interpretation of a section is up to us if someone, and then we can in the meantime make the other amendments. So with that, I think we've worked issue of the supply of drugs and payment for equipment, and we'll look at the procurement systems further, what has to be done. And we will meet in 2 weeks' time to ensure that all this is presented to Cabinet and the next steps are taken. Then of medical personnel who are not yet been registered in the SLMC, Health Ministry, SLMC and the Secretary to Prime Minister will have the necessary amendments to the regulations in the next 2 weeks. Kidney transplant for overseas patients are being allowed, and all applications for medical schools have to allow them in respect of, I think, Kuliyapiti Hospital must be fully equipped. The Treasury also to give priority so that Vayamba students will study at Kuliyapiti and Kurunegala becomes available for the Kurunegala University College. We'll look at the full utilization of the KDU hospitals, and we have to ensure that there should be no excuse as to delay in people getting drugs. Next issue is the personnel available. So that the ministry will report to us what has to be done. And all health facilities must be fully utilized before we go in for new facilities. We also want transparency in drugs. So all the drugs in Sri Lanka, there will be websites run by the Health Ministry which will say the total amount available and the amount available in each hospital, which will change daily as they consume the drugs, and the networking system so that even drugs can go from one hospital to another without having to go through the usual bureaucratic setup. And finally, of course, in training people, I don't think we have to change the regulations for nurses that even people with arts subjects can be taken up for training. And doctors' retirements, we've taken the position to allow them to go up to 63, and also for other special cases which the ministry will mention.